Okay, so let's talk about heart health. It's something everyone thinks about, right? Keeping the old engine running smoothly.
Definitely. It's universal.
And you always hear this thing, maybe from like your uncle or someone, that, oh, a glass of red wine, that's good for the heart.
Right, that persistent idea.
Yeah.
Is it just wishful thinking, or is there something to it?
Exactly. So for this deep dive, we figured let's actually look at the science. We've sifted through a whole bunch of studies to see what's fact and what's, well, maybe just nice to believe.
Yeah, it's a question we get asked variations of quite a bit.
Yeah.
And it really taps into that desire. Can something enjoyable also be beneficial?
Uh-huh.
So we looked at research mainly from 2002 up to 2022, a mix of things, randomized controlled trials, which are pretty rigorous, but also longer-term observational studies, cohort studies, case control.
Okay, so different kinds of evidence.
Right. And from different places too, Spain, Italy, the U.S. feature quite a bit, trying to get a reasonably broad view of what the science says about moderate red wine drinking and cardiovascular health.
And our mission here, like always at Boost GB, is pretty simple. We don't do the research ourselves, but we want to make it accessible.
Exactly. Unpack the potential benefits, how they might work, but also, and this is really key flag, the caveats, the limitations.
Yeah, the buts.
The crucial buts. We want to give you the clear insights, the bottom line, without you needing a PhD to follow along. You want to know what's what, and, well, that's what we're here to do.
Okay, so let's get into it. What does some of this research actually suggest? What are the potential upsides for your heart with, moderate red wine?
Well, the headline finding, the one you hear most often, is that several studies do point towards a possible link,
Okay.
a potential association between drinking red wine moderately and having a lower risk of developing heart disease.
That's the big one, isn't it? The one that gets everyone's attention.
It certainly is.
Yeah.
But the story seems to have a few more layers. There's also evidence suggesting it might play a role in how your body handles blood sugar.
Oh, interesting. How so?
Researchers have seen signs of potentially reduced what's sometimes called sugar resistance, or insulin resistance, if you know that term.
Right, I've heard of that.
The idea is your body might become, let's say, more efficient at using glucose, better sensitivity to insulin.
And that matters for the heart because...
Well, better blood sugar control could lower the risk of getting type 2 diabetes. And diabetes, as we know, brings a whole host of cardiovascular complications with it. So it's potentially protective in that way, too.
Okay, so it's not just a direct heart thing. It's also tied into this whole metabolic picture, like blood sugar.
Precisely.
Now, you hear a lot about, is it polyphenols in red wine? What's the deal with those?
Oh, yes, polyphenols. They're really central to this conversation. Red wine, especially red, is packed with these natural compounds from the grapes.
Like what kind of compounds?
Well, the famous one is resveratrol. You might have heard of that.
Vaguely.
And also various flavonoids. These act as antioxidants in the body.
Antioxidants. Like they fight damage.
Exactly. Think of them as protectors. They help neutralize unstable molecules called free radicals. You can imagine free radicals as, like, tiny troublemakers bouncing around, damaging cells, including the lining of your blood vessels.
Okay.
Polyphenols step in and basically disarm them, help clean things up.
Like a little internal maintenance crew for the blood vessels. That makes sense. What about cholesterol? I feel like I've heard red wine mentioned in relation to that, too.
Yes, that's another area where there's some suggestive evidence. Some studies indicate moderate red wine intake might help improve the balance of cholesterol.
How? Like lowering the bad stuff?
Potentially, yes. It might help nudge down the LDL cholesterol. That's the bad kind that can clog arteries. And there's even some indication it could give a slight boost to HDL, the good cholesterol that helps clear plaque away.
So less gunk building up, maybe a bit more cleanup happening.
That's the potential mechanism, yeah. Less of the bad, maybe a tiny bit more of the good.
Interesting. So these polyphenols, these antioxidants, what else are they thought to be doing in there?
Well, resveratrol, specifically, gets a lot of attention for its potential effects on the blood vessels themselves.
Okay.
Research suggests it might help keep them more flexible, more elastic.
Like less stiff.
Exactly. Less stiff, more resilient. It seems to help them relax better and might make them less prone to damage. Plus, it has anti-inflammatory properties.
Ah, inflammation again.
Yes, it can help reduce inflammation within the blood vessel walls themselves, which is really important for smooth blood flow. Think of making your arteries more like, I don't know, supple hoses instead of rigid pipes.
That's a good visual. That definitely sounds important for keeping everything flowing smoothly. And you mentioned lowering long-term, low-level inflammation. That seems to be linked to everything these days.
It really is. This kind of chronic simmering inflammation is increasingly seen as a major player in lots of long-term illnesses, heart disease being a prime example.
Right.
So the anti-inflammatory effects of these polyphenols in red wine might contribute to calming down that background inflammation in the body.
Okay, wow. So just to recap the potential pluses we've touched on, maybe lower heart disease risk, maybe better blood sugar handling, the antioxidant protection from polyphenols, potentially better cholesterol balance, more flexible blood vessels, and maybe less chronic inflammation.
That sums up the main potential benefits highlighted in some of the research, yes.
It sounds like quite a list. But how? How does red wine actually do these things inside us? What are the mechanics behind it?
Great question. Let's peel back that next layer. One key mechanism seems to involve improving the health and function of the endothelium. That's the inner lining of your blood vessels.
Okay.
Red wine, possibly through those polyphenols again, seems to boost the production of something called nitric oxide.
Nitric oxide. What does
Yeah.
that do?
Think of it as a signaling molecule. It basically tells the muscles in your blood vessel walls to relax.
Oh, so they widen.
Exactly. They relax and widen, which is called vasodilation, and that improves blood flow and can help lower blood pressure. It's like opening up extra lanes on a highway during rush hour.
Okay, easing the traffic flow in our arteries. Got it. Makes sense.
Precisely. And there's even some more sort of cutting-edge research hinting that components in red wine might help with repairing minor damage to blood vessels
Really? How?
by possibly encouraging the proliferation of endothelial progenitor cells. These are like special stem cells that can help patch up damage to the vessel lining.
Wow, like a little internal repair crew on standby.
Kinda, yeah. It's fascinating stuff. And then if you link that back to the blood sugar aspect,
Right.
the connection between better blood sugar handling, reduced inflammation, and potentially lower risk of those diabetes-related heart issues, it shows how these different threads might weave together to support overall cardiovascular health.
Okay, that's starting to paint a clearer picture of how it might work. But you said earlier, crucially, that the benefits aren't guaranteed just because the polyphenols are in the wine. It depends on us actually using them. Tell me more about that, this absorption idea.
Yes, bioavailability. This is super important. Just because something beneficial is in your food, or drink in this case, doesn't mean your body absorbs it all and gets it to where it needs to go.
Right, like you eat spinach for iron, but you don't absorb all of it.
Exactly like that.
Yeah.
Bioavailability is the fancy term for how much of a substance actually gets absorbed into your bloodstream and is available to have an effect. And with polyphenols from red wine, this can vary quite a lot between people.
So two people drinking the same wine might not get the same polyphenol hit, so to speak.
Precisely.
What makes the difference then? What affects how well we absorb these things?
Several things. Your overall diet plays a big role. For instance, there's some evidence that consuming healthy fats, think olive oil, nuts, avocados, around the same time as the red wine, might actually help your body absorb certain polyphenols better.
Oh, interesting. Like the fats help them dissolve or something.
Something like that, yeah.
Yeah.
It aids the absorption process. And another huge factor is your gut health.
The microbiome.
Exactly. The trillions of bacteria living in your gut. A healthy, diverse gut microbiome seems to be much better at breaking down these complex plant compounds, like polyphenols, and making them available for your body to absorb.
Wow. Okay. So the Mediterranean diet connection makes sense. The wine, the olive oil, the nuts, and probably a healthier gut from all the fiber, too.
It all ties together, potentially. Your diet, your gut bacteria,
Yeah.
they significantly influence whether you actually get those potential polyphenol benefits. It's not just about the wine itself.
That's a really key point. It's part of a bigger picture. Now,
Mm-hmm.
we absolutely have to talk about the elephant in the room. This is alcohol we're discussing. What are the big warnings, the limitations, the stuff we must be careful about?
Yes. And let's be crystal clear here. While moderate consumption might have these potential links we've discussed, the dangers of drinking too much alcohol are serious, well documented, and frankly, they dwarf any potential subtle benefits.
Okay, like what specifically?
We're talking significant risks, liver damage, obviously, increased risk of accidents, addiction and dependency issues, which are devastating, and crucially, a major increased risk for several types of cancer.
Right, cancer.
Alcohol is classified by the World Health Organization as a Group 1 carcinogen. That's the highest level of certainty. It means there's strong evidence it causes cancer in humans' mouth, throat, esophagus, liver, colon, breast.
Wow.
And not a small effect. Alcohol contributed to something like 740,000 cancer cases globally back in 2020. It's a major factor.
That really puts things in perspective. So even if there's a tiny potential heart benefit at low doses, going even slightly overboard wipes that out and brings in these massive risks.
Absolutely. The risk curve for alcohol isn't linear for all outcomes. For some things, like certain cancers, the risk starts to increase even with relatively low amounts of alcohol.
Okay, that's vital context. What other cautions should we know about?
Well, there's still a bit of scientific debate about whether the potential cardiovascular benefits seen in some studies are truly from the polyphenols specifically, or if maybe the alcohol itself in very small amounts has some effect.
Oh, really?
Some researchers argue that low doses of alcohol might have some blood-thinning effects or affect cholesterol slightly, independent of the polyphenols. It makes it tricky to definitively say it's the resveratrol doing this, or it's the flavonoids.
So we can't fully separate the effects of the alcohol from the effects of the grape compounds yet.
It's challenging, especially in observational studies where people are just drinking regular wine. And then there's the whole issue of what moderate actually means.
Yeah, that seems fuzzy.
It really is.
Yes.
There's no single universally agreed upon definition. Guidelines vary, and what's truly moderate for one person might not be for another, depending on sex, weight, genetics, overall health.
Right, and is the amount of polyphenols even consistent in red wine?
No, not at all. That's another big variable. The polyphenol content can differ hugely based on the type of grape, where it was grown, the climate that year, the winemaking techniques used. A cheap, mass-produced red might have far fewer beneficial compounds than a carefully crafted one from a specific region.
Okay, so you can't just grab any bottle and assume it's packed with resveratrol.
Definitely not. And what about the long haul? Do we really know what happens if someone drinks, say, one glass of red wine every single day for 30 or 40 years?
Good question. Do we?
The data on very long-term, consistent, moderate consumption is still pretty limited. Most studies look at shorter time frames or rely on people recalling their drinking habits over many years, which isn't always accurate. So the full picture of the cumulative effects over a lifetime isn't perfectly clear.
And you mentioned earlier that the research itself might have some gaps in terms of who's being studied.
Yes, that's a significant limitation historically. A lot of the research, especially older studies, tended to focus heavily on middle-aged men of European descent. Women and people from diverse ethnic backgrounds have often been underrepresented. And that matters because physiological responses to alcohol, metabolism, even dietary interactions could differ between these groups.
So the findings might not apply equally to everyone.
Exactly. We need more inclusive research to be sure the conclusions are broadly relevant.
Okay, so definitely quite a few question marks and important caveats still floating around. Where does the research go from here? What are scientists trying to nail down next?
There are several really interesting directions. One big focus is trying to isolate the specific effects of individual polyphenols.
Like just study resveratrol on its own? Or specific flavonoids?
Precisely. Using purified compounds and controlled studies to understand exactly what each one does, at what dose, and how they interact. That helps get past the complexity of the whole wine matrix.
That makes a lot of sense. What else?
Another key area is tackling that bioavailability problem we talked about.
How to get more of the good stuff absorbed.
Yeah. Researching ways to enhance polyphenol absorption and utilization. Maybe through specific food pairings, maybe through formulation techniques, maybe even by modulating the gut microbiome. If we can improve bioavailability, the potential benefits could become more reliable.
And what about trying to get the alcohol out of the equation?
Absolutely. There's a growing interest in studying non-alcoholic red wine.
Right, like dealcoholized wine.
Exactly. This allows researchers to give people the polyphenols and other grape compounds without the alcohol, making it much easier to see if the benefits are truly coming from the non-alcoholic components.
That seems like a really smart approach to isolate the effects. And what about making the studies more representative?
That's crucial. Future research absolutely needs to prioritize, including diverse participant groups, more women, people from various ethnicities, different age groups, to make sure the findings are genuinely applicable across the population.
Makes sense.
And finally, we just need more well-designed long-term studies, following large groups of people consistently over many, many years to really understand the lifelong impacts of different drinking patterns, including sustained moderate consumption.
Okay, so lots of work still to be done, but some clear paths forward for the science. Let's try and bring this home for people listening. What are the practical takeaways? If someone enjoys red wine, how should they process all this information?
I think the absolute number one takeaway is this. Red wine is not medicine. It's not a health food. It's not a magic bullet for your heart.
Right, not a prescription.
Definitely not. While there might be some potential subtle benefits linked to moderate intake, likely driven by those polyphenols, these potential upsides are nuanced. They depend on lots of individual factors we discussed, and honestly, they're likely overshadowed by the very real and significant risks of drinking too much.
So perspective is key.
Hugely. Think of it like this. The potential cardiovascular tune-up from red wine polyphenols, if it exists, is minor compared to the full engine overhaul you get from a genuinely healthy lifestyle, good diet, regular exercise, not smoking.
So if you do drink, moderation is non-negotiable. What does that look like, practically speaking?
Generally, the commonly cited guidelines are up to 1 standard drink per day for women and up to 2 standard drinks per day for men.
And a standard drink of wine is about 5 ounces, right? Or 150 milliliter.
Roughly, yes. But again, that's a general guideline. Individual factors matter. If you have health conditions or on medication or just metabolize alcohol differently, even that amount might be too much. Less is often better.
And if someone chooses to drink that moderate amount, any tips to potentially maybe maximize the polyphenol aspect?
Well, pairing it with a healthy meal probably helps, as we discussed, especially a meal rich in those healthy fats and fiber, like a Mediterranean-style pattern.
Right, the olive oil, the veggies, the nuts.
That whole dietary pattern is heart-healthy anyway, and it might help with polyphenol absorption. Plus, drinking with food slows alcohol absorption too.
Good point. Now, what if someone doesn't like red wine or just chooses not to drink alcohol at all, but they still want those potential polyphenol benefits?
That's a fantastic point because the great news is you absolutely do not need red wine to get polyphenols.
Where else can we find them?
Oh, loads of places. Berries are packed with them. Blueberries, raspberries, strawberries, dark leafy greens, nuts, especially walnuts and pecans, seeds, dark chocolate, the really dark stuff, in moderation.
Dark chocolate.
Green tea is another excellent source. Beans, whole grains, they're abundant in the plant kingdom.
So focusing on a colorful, plant-rich diet is probably a much safer and more effective way to get those beneficial compounds.
Absolutely. You get the polyphenols without any of the risks associated with alcohol. Plus, you get all the fiber, vitamins, and minerals from those whole foods, too.
Makes perfect sense. And remember, those individual factors, diet quality, gut health, they still matter for absorbing polyphenols from food too, right?
They certainly do. It all works together.
Okay. And just to be absolutely clear, are there people who should definitely avoid alcohol, including red wine, altogether?
Yes, unequivocally. Pregnant individuals should not drink any alcohol, 0. The risks to the developing fetus are too high.
Okay.
Also, people taking certain medications that interact with alcohol, check with your doctor or pharmacist. Anyone with a history of alcohol abuse or addiction, obviously, people with liver disease or certain other medical conditions. If in doubt, always talk to your healthcare provider.
And let's just hammer this home one last time. Regardless of any potential subtle heart benefits at low levels, alcohol is classified as a neurotoxin and a carcinogen. That's just a scientific fact.
It is, and that fact needs to be weighed against any potential and still somewhat uncertain benefits.
Okay, so wrapping this all up, the verdict seems to be moderate red wine might, keyword might, offer some small potential heart advantages, probably thanks to polyphenols. But it's complicated.
Very complicated. Lots of ifs, buts, and maybes.
And these potential benefits are easily outweighed by the known serious risks of drinking more than a moderate amount. The real focus should always be on the bigger picture of a healthy lifestyle.
Exactly right. It's about the overall pattern. A balanced, nutrient-rich diet, staying active, managing stress, getting enough sleep, not smoking. Those are the cornerstones of heart health. Red wine for some people in strict moderation might fit into that picture, but it's certainly not essential, and it's definitely not the star player.
So here's a final thought for everyone listening, something to chew on. Given the complexities we've discussed and the undeniable risks tied to alcohol, what other safer sources of those potentially beneficial polyphenols could you easily add to your day? Maybe it's grabbing a handful of berries for a snack, adding some walnuts to your salad, or switching your afternoon coffee to green tea sometimes, just something to consider.
Good food for thought.
And remember, if you appreciate these kinds of deep dives where we try to make complex research clear and accessible, because, again, we don't do the research, we just make it understandable, head over to boostgb.com. You can sign up for the free weekly newsletter there, get more insights like this delivered right to you.
It's a great way to stay informed. We hope this discussion has helped clarify the picture around red wine and heart health. Until next time, stay well.